Dr. Josh here with Freedom Physical Therapy, and today we're going to cover some hip anatomy and some hip function and how that can affect our performance and also where it can create pain kind of up and down the chain. So hip joint is a ball and socket joint, so it does allow for quite a bit of movement, but the nature of it, it's a much more stable joint than the ball and socket joint of our shoulder. The socket on this one really covers up the ball. So we have some really good hip stability just from the joint itself. We're going to take a look at Josh's mobility here from Body Heal. He's gracious enough to volunteer for us. He's got some pretty decent hip mobility. He's a little bit limited in his flexion here. We'd like to see him up around like 120 to 130 degrees. We're probably close to like 100 right here. And then we're going to check rotation. Not too bad, a little bit limited on that internal rotation there. We'll compare it to the other side here. Definitely better flexion on this left side, but his rotation is not quite as good on this left side. What that's important though is if we can't rotate when we, especially as we go into that squat, we need that flexion, kind of hip rotation to get us into that really good squat position. If we can't get there, then our body is going to try and find that motion somewhere else. Usually that's in the knee or the low back. That's kind of where you get that arch back position or that kind of fall forward or the early pelvic tilt, or you'll see the knees kind of deviate in, or you'll get like a twisting motion at the knee. So very common if the hip doesn't move to get knee or back pain squatting or deadlifting. We're also going to take another look here, have Josh flip over, lay on his stomach. We're going to check hip extension here, which is moving that hip back. So we're going to go straight leg first, and then we'll check with the bent knee, but it's not too bad. Stabilize a couple points here. Check the other side. So his left leg here is a little bit stiffer into extension, and why we care about extension is especially walking or any like deadlift, swing, you're going to get that hip extension, snatches, cleans. If we don't have this hip extension to let our hip go all the way back, we're actually going to get an arch or like an extension in the back, which will feed into a lot of that lower back pain that people often complain of or often get if they've done high volume or high weight extension exercises. We also see this with hip thrust. It's common that if you don't have that hip extension to get to the very top of a hip thrust, we'll start arching kind of in through the back there. So some key points to take away if you guys have been dealing with some hip, back, knee pain, please reach out to us, Josh at Body Heal Therapy or at Freedom Physical Therapy and Wellness, and we'd love to hear from you.